Welcome to Gamble with Brandl. Today we have a patient with a 20-year history of seizure disorder. The patient presents with gum tissue covering the upper third of the teeth, and also the gums are bleeding when touching them with a fine instrument. Which of the following drugs are most likely responsible for the patient's symptoms? And we are here given a couple of answer choices. So the patient comes in with a seizure disorder, a history of a seizure disorder, and actually when we look at these drugs, these are all anti-seizure medications, so that fits very well. And what does the patient present with? So the patient has gum tissue and also gums that are bleeding, so that sounds like gingival hyperplasia. So the gum gingival tissue is growing a lot, so hyperplasia, too much growth. And that obviously can lead to severe dental problems because worst case scenario, at one point the teeth can fall out when the gums are overtaking. So which of the drugs causes this adverse effect? So for all these anti-seizure medications, we know a lot of adverse effects because patients with seizure disorder are on these drugs for a very long time, so that's more likely there's more time to develop adverse effects. And also these drugs are all fairly old, so we know quite a lot about them. So one of them is very famous for causing this adverse effect, and this is a drug Phenytoin, and that's actually the correct answer. So Phenytoin causes a lot of different adverse effects. Let's just review what other adverse effects Phenytoin causes. So there's one nice mnemonics if you just write Phenytoin, all of these letters stand for different adverse effects. So P stands for CYP inducer, H stands for hirsutism, so this means a lot of hair growth. E stands for enlarged gums, and that's actually the gingival hyperplasia. NY stands for nystagmus. T stands for teratogenicity. O stands for osteomalacia. So it's pretty toxic to the bone. And I stands for interferes with folate absorption. Because Phenytoin looks a bit like folic acid, at least it competes with the same transporter that also folic acid uses in the GI tract, and you always should supplement patients on Phenytoin with folic acid. And N stands for neurological symptoms. Well, that's pretty unspecific because all of the anti-seizure medications are having some neurological adverse effects, because that's what they do. They suppress electrical activity in the brain. And that's why you also generally see all kinds of adverse effects that are typical for if you have not as much electrical activity in your brain, meaning if you have some activities that require a lot of brain activity, such as looking at a certain point in the distance. And so if you cannot really focus, that's when nystagmus is going to show. So when the eyes cannot kind of hold still. And then also things like just a clumsy gait, ataxia. It's very typical for all kinds of anti-seizure medications, because if you want to go on a straight line, also requires some electrical activity in your brain. And so on and so forth. So all kinds of neurological symptoms, slurred speech, ataxia, nystagmus, diplopia, seeing double vision. So these are these kinds of symptoms. So these are all different adverse effects of Phenytoin. So quite a lot, and it's very helpful to remember them. Let's also think about these other drugs, because these are all famous anti-seizure medications, and they all have very important important adverse effects. Let's do carbamazepine next. So carbamazepine is also an anti-seizure medication. Actually, those two work basically the same. They all prolong the inactivated state of the sodium channel so that you have less of fast range of action potentials. Carbamazepine is also a CYP inducer, and more especially it's a so-called auto-inducer. So it induces its own metabolism. So it's a very typical scenario. Somebody's put on carbamazepine, all good, seizure-free, 2 weeks later another seizure. Well, we have to consider that carbamazepine induces its own metabolism, and so sometimes you have to titrate again carbamazepine after a little while because the CYP enzymes got induced and then there's more metabolism. So C, car, and then mazepine, so let's write it that way. So C stands for CYP inducer, A stands for increase ADH. It's one of these drugs that can increase your ADH level. Well, antidiuretic hormone, so you're gonna hold on to more water, more dilution. You can get hyponatremia, which is kind of dangerous because it means there's going to be water drawn into the cell, and so cells swell, and that can also actually by itself lead to seizures. And then carbamazepine can also lead to a rash. And there's also a famous HLA allele B1502 that shows correlation with the rash. So if you have that, then there's an increased likelihood to get a rash, and this can also progress to Stevens-Johnson. So it's dangerous, and it's recommended that this is tested before you put some money on carbamazepine. So that's for carbamazepine. What about valproic acid? Also a famous, very old anti-seizure medication, has different mechanism of actions, also prolongs the inactivated state of the sodium channel, also blocks T-type, calcium T-type channels, and does other stuff. So a pretty broad anti-seizure medication, valproic acid. Always remember that stands for weight gain. Valproic acid for weight gain causes weight gain, so that's a V. And then Al leads it to alopecia, and then also has a lot of liver toxicity. I mean, it's rare, but it can be fatal. And that's valproic acid. And you can also see here again, so we have the alopecia on the one hand for valproic acid, and then the hirsutism on the other hand for phenytoin, and even they share a mechanism of action. They both prolong the inactivated state of the sodium channel. So pretty remarkable in two totally opposite directions. Then we have Lamotrigine, is also an anti-seizure medication in terms of adverse effects. It leads to a Lamotrigine life-threatening rash. So L stands for life-threatening rash. And that's also super important to know, because if somebody is on Lamotrigine and develops a rash, you need to take the patient off the medication because it can progress to Stevens-Johnson syndrome. And so that's something to remember for Lamotrigine. Unfortunately, there's no HLA correlation or so. It's just like you put the patient on this. If they develop a rash, take them off. And then Topiramate has also some things that we should remember. So Topiramate gives some cognitive impairment. So maybe not such a good drug for college students or students. Cognitive impairment, very clear with Topiramate. And the other thing, it can lead to weight loss. So you can think top shape with Topiramate. So weight loss here as an example, it's so good at it that it got even marketed also as a weight loss drug. So together with another medication. So you can here see also we have a medication in the anti-seizure section that causes weight loss, and then we have our famous valproic acid leads to weight gain. Okay, so we have now used this question also to review some of the most important adverse effects for anti-seizure medications. But this scenario was just talking about enlarged gums, gingival hyperplasia, as it's a very important adverse effect for phenytoin.